So now when we start to talk about cardiac assessment, we have to look at subjective data versus objective data. Subjective data that you remember, this is what the patient is actually telling us, the information that they are giving us. Health information, functional health patterns. What are some examples of subjective data? This is where we're going to ask the patient or the client a history. Have they had a history of chest pain, shortness of breath, fatigue? Do they drink? Do they smoke? Any history for cardiac, we want to ask about history of rheumatic fever, streptococcal throat infections, congenital heart disease, stroke, palpitation. If they feel dizzy with position changes, they feel orthostatic hypotension. So in their case, when they stand up, do they feel dizzy or lightheaded? Hypertension, any viscosities or any thrombophlebitis history. Anything that thinks now is the part where we're starting to get in system by system. So we're talking cardiac. So assessment of just the cardiac system, and we're trying to focus the information. So anything with circulation, perfusion, heart rate, shortness of breath, edema. We're asking the patient if they've had these. Remember, when we go to objective data is what we visualize, what we assess on the patient during the examination. We also want to talk about medications. We need to ask the patient, what medications are they currently on? Have they been taking aspirin? We know aspirin will prolong blood clotting time. A lot of times aspirin is in many over-the-counter cold medicines. Patients in cardiac issues may be taking a baby aspirin every day. Surgical treatments, any past surgical history. Then we also want to know about the patient's health perception, their actual management pattern or plan. What do they perceive about their health? What do they do in order to decrease risk factors for heart disease? Do they exercise? Have they ever had any, or have they noticed any cardiac symptoms? Do they smoke? How do they smoke? What do they smoke? How often do they smoke? All those good questions. Same with alcohol. How much alcohol do they drink? What do they drink? So I just added a slide so we could talk just a little bit more about subjective data. So some other things that we would want to maybe ask that would fall under the subjective category, because you're doing a admission history, we are going to ask maybe about some genetic factors. Did anyone in their family have hypertension, cardiac disease? What is their nutrition? What type of diet do they have? Is the patient underweight or overweight? We know that if they're underweight or overweight, this can lead to cardiac disorders or complications. The heart is trying to work harder to pump out excess weight, not excess weight, but they're trying to pump harder because we have excess weight on our body or body fat, so the pump has to work harder. Whereas if we don't have enough weight on our body and our electrolytes are out of balance, we still are trying to work harder to maintain a balance of homeostasis in our body. Elimination patterns. Is the patient on diuretics? Maybe they're up in the middle of the night urinating a lot. Sometimes medications over the counter don't correlate or mix well if someone is on a hypertensive medication and can cause urinary tract issues. Exercise pattern. Do they exercise? What type of exercise? It may be just a matter of asking the patient how they sleep or rest. Cardiac problems disrupt sleep. It may be where people are having shortness of breath and they wake up at night. They may have shallow respirations. You have a box that goes over history or health history for the cardiovascular system on page 693. It kind of breaks it down in all the different things that we were talking about. It's just important to kind of glance that over to know what kind of questions you would ask your patient. How would you do the assessment? We always want to know if the patient is alert and oriented. We want to know if they've had any problems with dysrhythmias, hypertensions, any kind of diagnostic procedures, and what is their perception of it? What's their perception of their disease process? How do they cope with it? What are their values and their beliefs? We talked about culture. Culture always plays an important role in everything that you do in healthcare. So now we're going to talk about objective data. Objective data is the actual physical exam. It includes your vital signs, peripheral vascular system. When we talk about assessment for the cardiovascular assessment, we are using 3 techniques: inspection, where we're looking; palpation, where you're feeling; and auscultation, where you are listening. So when we're actually inspecting the cardiovascular system, what are some things that we want to look at? We want to look at skin, the color. Are they pale? Do they have blue tinged lips? We want to know, is there clubbing? Do they have stasis ulcers? Edema on the extremities sometimes is caused by right-sided heart failure. We want to inspect the large veins in the neck. They have an internal and an external jugular vein. You're assessing for jugular vein distension. So if you have distension and a prominent pulsation in the neck veins, it is referred to jugular vein distension. This can also be caused by right-sided heart failure. So essentially, if you have a patient who is supine and you elevate them to a 30 to 45 degree position and you see distension or a prominent pulsation of those neck veins, they have jugular vein distension. That's not a good sign. Palpation. What are we palpating? We want to palpate an edema. So if we have a patient who has edema on the lower extremities, we need to grade it from a +1, which is mild pitting, with a slight brief indentation, to a 4+ or +4, where we have venous deep pitting indentation and it lasts for a long time. The other thing that you can do is palpate the pulses. Pulses are palpated in the neck and the extremities, and it's assessing information on arterial blood flow. The other thing that you are doing when you're assessing pulses, we're assessing the rhythm. Is it a regular or an irregular rhythm? And the force. When you palpate carotid pulses or the carotid arteries, you do not palpate them together. If you do, your patient will pass out. So you only assess one at a time.